Well, shoot, where's the
Hey Tracy, Melinda, it's Amy. Can y'all hear me?
calendar?
Thank you. Thank you.
Hey, Melanie, Amy, can you all hear me?
You need to mute all the participants.
Yes. Good afternoon, everyone. Thank you for joining the call today or the meeting. I want to ask you, I think I have muted everyone's that has joined the meeting, but if not, if you don't care to mute yourself. And I am Tracy Aaron, Health Education Director here at the Lake Cumberland District Health Department. We are going to be talking about COVID-19 and our response here in the Lake Cumberland area. There's a panel, there are questions that have been sent in to us over the past week, and we'll be answering those questions from the executive team here at the health department. But as we start off, I'm going to turn it over to Amy Tomlinson, our preparedness manager, and she's going to give an update on COVID-19 across the 10 counties.
Hello, everybody. This is Amy. I like this whole format. This is like the Brady Bunch kind of thing. It's good to see your all's faces. I appreciate you showing us what you look like, and it's nice to put a face with a name on some of these. I'm the preparedness manager for the health department, so I do all of our disaster and emergency planning. So Mr. Crabtree is usually the one who does these opening remarks. He's our executive director. He is en route to Russell County, I think, this afternoon, because we have our first confirmed case there that he will be announcing with the county judge and the usual groups over there. So he asked me to fill in his place, and I'm just going to give you a brief overview of our numbers, where we're at today, and then just a few comments, and then we'll take the questions that were submitted previously. So our current count in Lake Cumberland District as of about 2 o'clock this afternoon, we're up to 25 total cases in our 10 county area. That includes 2 cases in Adair County that are self-isolated at home, 1 case in Cumberland County that is self-isolated at home, 1 case in McCreary County, which has now been released. And I will probably let Laura or some of the medical staff talk if that needs clarification. Basically, it means they've been without symptoms for a certain period of time and they're no longer being monitored daily and that kind of thing. Pulaski is up to 14 cases. 3 of those cases are hospitalized, 6 are self-isolated at home, and 5 of those have been released, meaning they're well enough to be released. Taylor County has 2 cases, 1 hospitalized, 1 self-isolated. Wayne County has now 4 cases, 3 of those hospitalized and 1 self-isolated. And Russell County has its first case today, and that person is self-isolated. So that's a total of 25 cases for the 10 county area. We still have 3 counties, Casey, Clinton, and Greene, that do not have confirmed cases at this time. So we have seen an uptick in cases confirmed just in the last few days since this week started. And I think that's just a testament that testing is being done and that we're starting to get those lab reports back. These aren't necessarily people who have just gotten sick, in the last day or 2. These are people who may have been sick and we're just waiting on test results. So it is important to note that we do expect these numbers to increase as that continues to happen, as we continue to get more lab results and things. I do expect numbers to increase in our 10 counties. And it's going to be extremely important for citizens in our 10 counties to follow the guidance that the state health department and the local health department is putting out as far as social distancing, hand washing, all of these prevention messages that we're putting out there. We have to treat this like the virus is in our communities at this point. It's here, so we need to be taking every possible precaution. Also on the call with us today, we have Laura Woodrum, our Director of Nursing, and Stuart Spillman, who is our Environmental Director. And I'm going to let them unmute themselves if they want to make a couple of opening comments, and then I'll give it back to Tracy to do questions.
Okay.
Stuart, you're muted if you can hear me.
Okay. No, that's not what we want. Hang on, I'm having a little difficulty.
Just come here. Okay. Stuart and I are actually in the same room, so let him just walk across the room and he can use my spot here.
Let me get my notes. Okay, we were getting a lot of feedback there, so I switched around. Since I last gave you all the update last week, what I wanted to tell you from that point is we've sent out some best practices to deal with people that might not want to comply with their isolation. We have worked on that. We have, this week, actually today, Amy had sent out some guidance that we'd worked together with to the schools regarding the homework packets that all the kids are getting and bringing back. So how to handle those packets. We do recommend a 24 hours on those packets. And we're still working on compliance. There's some questions I'll get into here after a while on that I see written down here. So I don't have anything else. Laura, do you have anything?
Mailman. I'm Laura Woodrum, as you said. I think I'm getting an echo. We are doing
Lots of feedback.
contact investigation. I'm going to move. So I don't get an echo. We are currently doing case and contact investigation on cases. We're monitoring those cases daily at this time and doing the proper and required reporting on those. Anything else right now is we're just taking calls as they come in, but mainly our focus is case and contact investigation right now.
Thank you, Stuart, Amy, and Laura. We're going to start into the question answering section. And I ask you all to, I have you all muted, but I do want to say if you have questions at the bottom of your screen, you're going to see a chat box. So if you want to ask questions, just type it in that chat box. First question is for you, Stuart, if you're going to be ready. There have been reports this past weekend of home improvement stores being overrun and some churches still holding public gatherings. What level of compliance have you seen across the district in regards to social distancing and closures?
Okay, that is true, and I believe that was actually addressed by the governor as far as Lowe's and Home Depots go. After he addressed that, we actually were able to go out, visit those stores, and we have found that they have taken the extra steps to ensure that their employees and customers are social distancing in the store. Now, as far as churches go, we're hearing of just a few having some in-person services. What we're doing is, we are begging these church people. We understand. I do understand, their convictions. I go to church twice on Sunday and on Wednesday night if I'm not at work. So we do understand that, but we also understand that we have cases in Pulaski County where many people who attended church ended up getting sick over this, and some of those people were very sick. So we're begging the churches to please come up with some different ways of doing that. There are, we have technology now. The governor spoke of the drive-in services that you can have as long as you distance and stay in your cars. So there's other things that you can do, and we're just imploring these people to do that. We're making contact with the ones that we know of that have had the services, and we're talking to those people personally to ask them to do that. We're not unlike anybody else. I mean, we don't want to go out and to shut a church service down. That's not what we want. We just want these people to understand and to think about this and to comply with the orders to keep their congregation safe and the community safe.
So Stuart, if you don't care just to stay there for a second, I think you answered one of the questions because it asked if there are specific type of businesses or gatherings that are of concern across the district. But I think you said you already talked about that. But how does the health department respond to people when there are violations? What do you all do?
So when we do have violations, of course, we have tried to take out over the past week to deliver a message to every business, personally deliver a message to every business with our staff talking about social distancing on those places that are essential. Now, if we're still getting other complaints, we usually will go out and we will try and make an in-person visit with those people, talk to them, see where they're at as far as complying with that. If not, our county attorneys and our sheriff's departments, along with us, are committed to, if we have to close these businesses, we're committed to doing that.
Okay, thank you, Stuart. Amy, this next question is for you, I think. Has the health department determined how the first case in Pulaski County may have gotten COVID-19?
Okay, so the first case that was reported in Pulaski County was just that. It was the first reported case. That does not necessarily mean that was the first case in the county. So as the investigation is continuing, the timeline is kind of altering and changing, and the picture is becoming clearer on certain things. So I don't know exactly the first exposure, how that occurred. That has not been revealed yet in our case investigation. It's entirely possible that someone who was never tested carried it here from somewhere and spread it, and they may have been asymptomatic. I mean, we just don't know at this point how it started. The fact is that it's here, and so we are doing our very best to investigate those cases that we are aware of and investigate the contacts that they may have had to prevent spread.
Okay, thank you, Amy.
Uh-huh.
Laura, this next question, there's a couple for you. What does it mean when a patient is released from quarantine? And then what does it mean for the other residents in that household where the patient has been quarantined?
So anytime a positive case is identified, they are placed into isolation, which what that means is they separate themselves from people who are not sick or people in their household. They need to stay home and keep their distance away from anybody living in that home. And that's the definition that we're following of isolation. Once they are released from isolation, 3 days, when 3 days have passed and they are without fever, and also 7 days after their symptoms first appeared. So both those criteria have to be met for them to be released from isolation. Contacts of positive cases are what we call quarantined, and that means they separate themselves. It restricts the movement, which means they stay at home. They monitor their temperature. So the incubation period is 14 days for COVID-19. So they stay quarantined for 14 days. Once those 14 days are up, then they can be released.
Okay, thank you, Laura. Amy, these next few questions are for you. Has there been any additional word on when mass testing will begin in our district? And how many kits do we have as opposed to how many are needed for the district?
There's not been specific word. I do know plans are being worked on at the state level. And we're actually on another conference call at the same time this is going on with some state partners about that and about how that's going to look. So I hope to have some more information on any kind of mass testing things very soon, but I don't know a timeline at this point. And I don't know about numbers. It would be different in every community depending on the population and the things like that that would be required. I have heard from the state level that the first attempts at these mass testing clinics would probably be regional. So it may not necessarily roll out to every county at the same time. They may do a couple in our district, maybe like east and west or something. I'm not sure what the arrangements would be exactly, but I don't look for this to happen in every county at the same time. So we needed to consider that.
Okay. The next question is for you also. How is the PPE situation for hospitals and other healthcare providers across their district?
The hospitals and the EMS agencies, from what I have been told, I've done informal surveys as I've spoken with our partners across the region. They're all seem to be okay at the moment. I do know there are some PPE shortages with some local providers. So people who are like the fast pace and the urgent cares and the after hours clinics and some of those, some of our long-term cares, I think, are not necessarily out of PPE, but they are in a much shorter supply than some of our other places. So those are places that we need to look at either increasing their supply if we can, or implementing some sort of conservation methodology with them so that they can save as much PPE as possible and not go through it as quickly as they are.
So are you in contact with those individuals to work some of that situation out with the PPEs, Amy?
I talk to some of those partners routinely. There is a healthcare coalition, healthcare preparedness coalition, that is made up of all of the healthcare facilities within our 10-county area, and they are meeting regularly. There's a coordinator for that coalition, and she's a state employee with the health department that's housed here within our district. And so she is doing, I think about 2 or 3 times a week, she sends out a survey to them that asks them their PPE usage rates, how much they have on hand, their inventory status, that kind of thing, and is helping to reroute resources. Like if somebody has a surplus, then they can pull that and redistribute it in the district as needed. So that is being monitored.
Okay. This one is for you also, Amy. How many ventilators are estimated to be here across the district?
Okay, so I checked with that hospital coalition person that I just mentioned, and the best numbers that she could give me were between 50 and 75 for our 10-county area. There's also a state cache that's available if it should be, if our supply should be exceeded and we would need additional ones, we could request those of the state.
Okay. Next question is yours too. Do you have enough data yet to determine if Kentucky's effort to flatten the curve for COVID-19 has been successful?
I see the same types of charts and things that you all see. So my personal opinion, I guess, is that Kentucky certainly seems to be doing better than some of our neighboring states. If you all saw the governor's briefing yesterday, you could see the color of Kentucky was less intense on that heat map than some of our neighboring states. And I do believe that's due a large part to the aggressive measures that the governor has taken and the local governments have taken in response to this. So I don't know that it's entirely possible to say that our curve is flattening, but I think we are doing a pretty good job in Kentucky.
Team Kentucky. Last question is yours. Or not the one I have, and then we have some in the chat box I'll get to, but has the department got any reports of local prescribers stockpiling pharmaceuticals rumored to treat COVID-19?
I have not heard that in our 10-county area. We have received phone calls from some pharmacies related to nebulizers and inhalers and different things for treatment of COVID patients, but I have not heard specifically of the stockpile that you're talking about in this question. No.
Okay. So a couple of questions from the Zoom chat line. Is there a protocol in place for federal prisons, like in Macquarie County, to report any COVID-19 results to the Lake Cumberland District Health Department? Also, do they have a deputy to report any positive cases to our local ambulances, rescue services, who will be the ones that are transporting them? Okay, good, thank you.
Want me to answer?
Labs are required to report positive cases.
Laura's here with me, and so you can probably maybe hear her, but she and I talked about this before because we saw this question come in before this started. And the labs where the specimens are sent are required to report diseases to the health departments. So that should still come through us. And then the second part of that question was about sharing information with ambulance services who would be transporting. And when the health department is notified of a positive COVID patient or a case, we do share that person's name with EMS chiefs and the infection control provider for the hospitals, so that they have that information in case that person presents or they get a call to go and transport that person. We would want them to have the information necessary to protect their crews and their staff.
Okay, thank you. I have a question from YouTube also, YouTube Live, and it says, how many tests have been administered? It says particularly here in Pulaski County.
I really wish we knew the answer to that. There is just no way to know that information. Labs come online every day, different labs, and different providers get more resources. And so, you know, testing is ongoing continually, and we just do not know. We do not have a good handle on who's doing testing and how many tests are done. The only way we have to track that is the confirmed cases. So a lab that's doing a test does not necessarily have an obligation to report the number of tests that they're performing, only the positives that they have.
Okay, thank you. I'm going back to the chat box now, and this is from Clinton County, and it says, are you planning on releasing a transcript again of the questions and answers? And we are planning on doing that, and it will be on our website. So those are going to be out there. Next question, it looks like it's from Taylor County, and it says, Taylor Regional Hospital announced earlier today that an employee has tested positive for COVID-19. Is that a third case in Taylor County, or was the second confirmed case a person who worked at TRH?
No, Taylor County has 2 confirmed cases. The case of the Taylor Regional Hospital employee was a resident of another county. So they were not a Taylor County resident.
All right. Next question again is from, I'm not sure, Macquarie County. It says, can you give more information on the decision to release the Macquarie County patient from quarantine only 8 days after the positive case was reported and 5 days after a court order was obtained in order for quarantine? Also, what about the other individuals who was required to be quarantined in that household?
Anyone that we have released from quarantine has met the criteria that I discussed earlier. And any other contacts of a positive case, COVID-19 case, have been instructed with their quarantine instructions.
Okay, thank you, Amy. Are there any other questions that anyone has? I don't see any more questions. Okay, so at this point in time, Amy, Sean was going to do some final comments. I'm going to turn that back over to you and let you finish that if you don't care.
Okay. Don't really have anything except just know that your health department is working diligently on this. There's a lot of staff here putting in a lot of hours on everything in your counties. We have local public information officers in each county, and hopefully you all know who those are, and you can reach out if you have a question locally to those partners, and they can help you get the answer that you need. At any time during the week, we do these calls weekly, but at any time during the week, if you have questions, you can reach out to Tracy or Melanie or your local public information officer and funnel questions that way back to us, and we'll do our very best to get answers for you guys. I want to thank you all very much for partnering with us and doing your best to get our story out there and spreading the word about what we need to be doing. Thank you all.
All right, thank you, Amy. And again, I just want to reiterate what Amy said. Thank you all for joining today. I encourage you, if you have questions, to send those into the health department, and we will go over them next Wednesday. or before that, if you send them to us, I guess I should say. And we will see you all next week. Thank you all.
Everybody in their